I'll open it up for questions, if any, before we move on to the next module.
Sure. How has the Affordable Care Act enabled mobile health care?
Very good question. There are provisions in the healthcare reform, Obamacare and so forth, that include some of the quality and cost effectiveness metrics that organizations need to be able to achieve. Meaningful use, the ability to leverage tools to achieve exchange of information, and with that ability also cut the costs that are required in the coordination of care with the center and any other centers. So it doesn't explicitly talk about mobile health as a way to achieve that. But it is recognized that mobile health is one of the tools that can be used in order to meet those objectives. And many of the centers that are trying to meet the outcome metrics of the healthcare reform are utilizing now some of these tools in order to demonstrate that they're able to. An example might be, for example, to be able to reduce readmission rates as a way to cut the costs that are required when a patient comes back to the clinic and so forth. They're doing studies to equip those patients of sensors and ability to communicate with the healthcare provider in order to catch early on the sign that the patient might need to come back before it's too late and it becomes extremely expensive. Or other studies to understand if there is any correlation or meaning between the care they have received and the way they're doing outside of the center and so forth. I will say, I think there is a lot of promise. We have not demonstrated that yet, so we need to be very I would say, honest about what we have achieved so far.
So I would imagine my health data stored in very different entities, like my genomes in 23andMe, and my fitness are in Fitbit, and my medical history is in doctors. I would think that if you connect them all together, it will provide a better picture for individuals and all for the communities, like what people need what. So how's that channel getting set up, or is it happening, or?
Very good question. There is unfortunately a tremendous fragmentation as of today, not just in the industry that mobile health is trying to disrupt, but in mobile health itself. And I'd say that's rooted in part in the existing scenario. We have many ways to store data, accumulate data, digest data, and even just getting past those technical barriers is difficult. Although I would say we're making great progress. There are still a series of more regulatory implications in doing that, concerns about privacy, confidentiality, and security that we still have to get around. Concerns about, I would say the key question, who owns your data today? And is it you, is it your doctor, is the application that you're giving your information to? And once you have identified who the owner is, then who is deciding who has to be able to share that data? In other words, you're trying to figure out where are the incentives in cutting down those barriers between integrations. And there are many players right now at the table, the private sector, the public sector, and so forth, and they're all driven by different incentives in a way. So it's becoming a very awkward conversation. I'm very optimistic. We've made tremendous progress. I think the technology is getting there thanks to the work of many entrepreneurs. And also the government has provided a lot of incentives for entrepreneurs who want to reduce this fragmentation in the space, but we're not there just yet. And I'm with you, I'm frustrated. I have a device and 3 apps whose information and everything else I use with my own brain to try to manage my own irritable bowel syndrome. So I'm leaving it on my skin, and I would really like to have something that's more integrated and continuous. It will take some more years to get there. Good question. Yes?
This is a completely hypothetical situation and the question before that. So we, when we allow people to track our data, like shopping patterns, for example, right? We get, Target sends you coupons for things that you don't know are coming. So do you envision a scenario where you're tracking my health, for example, blood pressure over time, and it comes to the point where you're already sending me medication?
Can you repeat the question, by the way? It's for the recording.
Of course. So you're talking about predictive health. You're asking if there will be a future in which we will be monitored for our daily information and receive recommendations for how to prevent or know about health issues that may come down the line just because of that passive and continuous monitoring, very much like Target is doing when they sell you promotion that may fit your interests based on what's upcoming. I think that's the future and the vision for the future that many in the community share, that we shall be able to manage our health in the same way we manage our money with Mint and any other financial platforms that allows us that granularity and that ability to look at different financial sources in one place so that we can have control of our money. Same thing we should be able to do with our health. We do that for Target, which I would say is much less critical to our happiness than our own health. Why are not doing it for our health? So that's the premise, that's the vision, and that I would say is what fuels the imagination of many who are active in this space in the entrepreneurial community. Your vision, you see, you're already in. I should move on to the next module.